Hello everyone, welcome back to Maskapai Domi. I'm your host, Aryo Jalo, and I'm very happy to be here with you all today. In this episode, we're going to discuss a very crucial topic that is currently making waves and transforming the medical world, namely the future of healthcare services, integrating generative AI into medical education and patient care. So, the development of generative AI in healthcare sector has grown very rapidly over the past few years. On one hand, this technology brings tremendous opportunities, but on the other hand, the challenges and ethical consideration are equally significant. To help us explore this topic in greater depth, we have a very special guest joining us today. In Riani Fitriasha is a public health professional with over 20 years of experience in primary healthcare, universal health coverage, health system strengthening, maternal and newborn health, and service delivery in Indonesia. At WHO Indonesia, she supports the Ministry of Health on PHC and UHC transformation, health policy development, quality improvement, infection prevention and control, and health system strengthening. Her work includes policy and program implementation, capacity building, strategic planning and coordination with government, development partners, and health stakeholders at national and subnational levels. Hello and welcome to our podcast, Mrs. Indraini Fitriasha. Thank you so much for taking the time to join us today. So, next, perhaps you could start by introducing yourself to our listeners and telling us a little bit about your role and involvement in the field of digital health or artificial intelligence.
Hi everyone, I'm Indraini. I'm public health professional with a background more than 20 years serving the people in community. So my journey in health began very close to the patients actually. And today I work with WHO Indonesia on universal health coverage and primary health care, where much of my work is about a simple question. How do we make a health system actually work for the people who need it? And that's also why I'm very interested in AI, not just because of what the technology can do, but because of what it can help people do better. So I'm very happy to be here and to have the conversation with you all.
Okay, thank you so much. It's an honor to be able to hear WHO's perspective, especially because the discussion is about AI in healthcare and are not openly related to technology, but also involve patient safety, the quality of education, ethics, and equal access to healthcare. With that in mind, let's begin our discussion. The development of generative AI in healthcare has been progressing very rapidly. From the WHO's perspective, how do you see the role of generative AI in shaping the future of medical education and healthcare delivery?
Thank you for the question, Jalu. Before answering this question from WHO perspective, let me start with a personal confession. I use AI a lot. Sometimes I come to it with a question, a half-formed idea, or a problem that I have been staring for a long time. And then in my work, I deal with questions around primary healthcare, universal health coverage, service delivery, and health system. And these are rarely problems with one perfect answer. Something I learned from using AI, the quality of the answer depend a lot on the quality of the conversation. If I ask a lazy question, I often get a lazy answer. I think everyone knew that, right? And then,
Yeah.
yes, but if I say, challenge me, or what am I missing? Or maybe look at this from the perspective of the patient. And if I want different other angle, I may ask, now look at it from the health worker perspective. What happened if that puskesmas hundreds of kilometers from a referral facility or specialist? Suddenly AI become much more interesting. Not because it has replaced my thinking, but because it has forced me to think again. So coming back to your question, how is generative AI shaping the future of medical education and healthcare delivery? It is not simply how intelligent AI can become. It is about how intelligently we choose to use it. So that's the bulk of the statement. It is about how intelligently we choose to use it. We need to recognize that AI is already here. I believe you guys, medical students, are using it, right? Health professionals are using it. Health systems are beginning to explore how it can support clinical care, administration, data research, and planning. The important question is how, and this is the main topic of our discussion, how do we use it responsibly? And what problem we are actually trying to solve using AI. So from WHO perspective, technology should never become the goal of itself. In health, our goal remains very simple. People should be able to receive the quality health service when they need it without experiencing financial hardship. I think if you recognize the sentence, that's what we call universal health coverage. It is when people need the care, they can access them whenever they need it without financial hardship. Okay, this is something important concept that every medical students, every health professional should understand it very well. And then this is where AI become interesting. Imagine you later on or current doctor or nurse or midwife working in remote puskesmas, far away from referral hospital. Perhaps internet and electricity is limited. Specialists are not always available, maybe not available. And the health workers is seeing many patients in one day. If AI can help the health workers access the right guidance faster, summarize information, help recognize a high-risk patient earlier, or prepare a better referral summary, that could be valuable of AI. However, if we introduce a sophisticated AI system to puskesmas, where medicine are unavailable, internet and electricity is not available, referral transportation is not there, or doesn't work, or there are simply not enough health workers, that we haven't solved the real problem. So again, AI can strengthen the health system, but it cannot replace the health system. We can be excited about innovation, we should. However, we should always bring the conversation back to people, health workers, and to health system. I think this is my answer for Jalu first question. Back to you.
Okay, thank you for that perspective. It's fairly clearly that AI should not be the goal itself, but rather a tool to help us solve actual problems in healthcare. Like you, the way you emphasize it, AI can strengthen a health system, but it cannot replace a health system. Okay.
Sorry, I cannot hear you.
Learning materials, presentations, videos, even clinical examination. In your opinion, what are the most promising applications of generative AI in medical education over the next few years?
Thank you for the smart question in this current situation, right? This is something I appreciate. So okay, to answer your question, for medical students, not only for medical students, for everyone actually, but specifically to medical students, AI open genuinely exciting possibilities, right? Your generation may be the first generation of doctor who will learn medicine with an AI companion along with you almost from the beginning of your education, right? And then when I was studying, of course, we learning from largely depending on what resource that we could access, right? Like textbook, lecturers, library, perhaps seniors. Now, let's have some imagination here. Let's say it is 2 o'clock in the morning, and you are trying to work a case of, let's say, a severe preeclampsia, about hypertension, proteinuria, sign of end of organ dysfunction, for example, and you're struggling to connect all of the pieces together and thinking, I still don't understand about this. Now you can ask AI to explain the concept differently and from different angle. You can say, explain this to me as the first year medical student. Or even you can say, please explain to me as high school student. So AI can help you with that, right? And then now you also can say that, please give me a clinical case. Also, we can say that, don't give me the answer, ask me question, and let me work through the diagnosis, right? So that can make learning much more interactive. Generative AI can also help create simulated patient conversation, right? Like you pretend there is patient there and you're a doctor, you can be simulated patient with the AI. And then it can help with the clinical cases. It can help with practice question and answer. It can help with educational material and also with the USCA scenarios, right? And then, but before, there is an important difference between using AI to learn and using AI to avoid learning, right? So you need to use AI to learn, not avoid the learning itself. If you immediately asking AI for the answer every time you encounter a difficult situation or question, you might become very efficient on finding answer, while you will becoming less capable of thinking the problem by yourself. So it is very dangerous for a doctor, right? So we don't need doctors who are only good on retrieving answer from the machine, but we need doctor who can think when the answer is uncertain. In real clinical practice, the answer is not always obvious. I think you know that, right? And then a patient may provide incomplete information, several diagnoses may be possible, and sometimes the case simply doesn't look exactly like the textbook. A doctor needs to be able to assess the evidence, manage uncertainty, and then make a sound clinical judgment and communicate it well with the patient. So that's the key for answering your question, actually.
Okay, so like the application is indeed very helpful with a clear risk, especially the distinction between using AI to learn and using AI to avoid learning. So, like, maybe people would relate to that because we have so many things to do, and then we have to like sneak in to do the task and multitask. So, however, there are also concerns about students potentially becoming dependent on AI. How can this technology support learning without diminishing students' critical thinking and clinical reasoning skills?
Thank you so much for the question. So this is probably one of the question I like most because I would encourage students to change the way they talk to AI. Don't always ask, what is the diagnosis? Try ask, here's the case. Don't tell me the diagnosis yet. Ask me what information I need next. Challenge my reasoning. Or give me 3 example explanation and ask me to defend which one I think is most likely. I really like this kind of back and forth question with AI actually. then AI become less like an answer machine and more like a sparring partner for your thinking. And there is also another important habit. It is verify. Generative AI main problem is it can be wrong while sounding extremely confusing, right? It can produce inaccurate, incomplete, or outdated information. It can even generate references that do not exist, right? This is very classical AI, right? That we see everywhere. So WHO 2024 brief on ethics and governance of AI for health highlights that these risks and emphasize the need for human oversight and verification of AI generated content. So I would tell medical students who are listening to this podcast for use AI to expand your thinking, not outsource your thinking. Because one day there will be a real patient sitting in front of you, and ultimately you're not the chatbot, right? You have you need to carry the professional responsibility for what happened next of your decision that you tell the patient, right? And then I can relate this personally from my own learning journey in health that has taken me through very different stage, from clinical training earlier in my career to public health and now to working on the health system. At every stage, I had to learn how to look the same health problem from different perspective. This is how I like to use UA today, AI today. Like sometimes I ask it to explain from the clinical perspective, and then I compare that from the patient perspective, and then from health system perspective. And the answer will be changed from which angle you ask, right? But most importantly is it also changed my understanding on the problem. So this is why I think AI can be such a powerful learning tool if we use it to open our perspective from different angles.
Okay, that is such a powerful point. That the rise of AI doesn't. I think that's a very practical way of looking at AI as a sparring partner rather than an answer machine. Instead of asking AI to immediately tell us the diagnosis, we can ask it to challenge our reasoning, identify what information we're missing, or present alternative explanations. So, this is directly related to the preparedness of future doctors and healthcare professionals. From the World Health um, perspective, what competencies should future healthcare professionals develop so that they can adapt to the use of generative AI effectively and responsibly?
Thank you. Okay, so we often hear that future doctors need to become more digitally literate, right? But that is only half of the story. So yes, future health professional need AI literacy and data literacy. There's no doubt about that in this area, in this era. They also need to understand what this system can do, what they're trained, where bias can enter, and how to assess whether an output is reliable. That's true. But at the same time, I think the rise of AI makes our human competencies even more important. Right? This machine, this human. Yeah. And then clinical reasoning, ethical judgment, communication, empathy, understanding uncertainty, knowing how to sit with a patient and explain something difficult, knowing when something on the screen does not match the person in front of you, the patient. These are what only human can do, right? So perhaps the future doctors need two strengths at the same time: digital fluency and deep humanity. I don't think those are competing skills. health professional, which include you in the future, should do very good at both because that's what patient actually need.
Okay, that is such a great and a good point that the rise of AI doesn't make human skill less important. In some ways, it makes them even more important because, like you said, AI don't have like the exact empathy that human possess, right? And I think that is such a good point to make. That we have to learn about empathy as well, like digital fluency and deep humanity too. Now, let's move from the field of education to clinical practice. Generative AI is beginning to be used to assist with medical documentation, the analysis of clinical information, and even decision making processes. Which opportunities seem to be the most promising, and what challenges should we anticipate?
Thank you for the question. I would look beyond the individual clinical consultation here. Of course, AI may help clinicians summarize patient history, support documentation, organize information, or identify pattern that deserve attention, right? But from health system perspective, there is another layer that is equally interesting. Imagine a thousand of puskesmas. We have around more than 10,000 puskesmas in Indonesia and hospital generating routine service information, right? AI can help us analyze and identify, for example, where hypertension control is poor, for example, in this big of data. Another example, where maternal health risks are increasing, right? And then where is medicine demand is changing. Imagine there is 10,000 puskesmas data. So we see the pattern. We also can see where barriers are preventing people from completing the referrals from puskesmas to hospital, and where community remain underserved. All of it we can see from the data. So besides identifying geographic service gap, like example I just mentioned, AI also can assist us to forecast demand for medicine, diagnostic, and workforce, right? Besides those case example, AI also can help forecast the need for medicine, diagnostic, and workforce, and inform more equitable resource allocation, right? So that moved the conversation from AI helping one doctor to AI helping a health system see where people are left behind, right? So it's not just about helping one doctor; it can help the whole system. But please remember also, AI learn from the data. Health data are not automatically neutral, right? If certain population are missing from the data, if rural population are poorly representative, if local language are absent in the AI system, or if the underlying health system already contain inequality, AI can reproduce and sometimes amplify those inequity. So when evaluating AI, any AI generated answer and system, we have to ask ourselves, from whom does it work? In which population what is developed and tested? The data can come from which population? Does it work equally well across different population, language, and setting? And perhaps more importantly, who might be missing from the data? Because that's something that we really need to think.
Okay, thank you. So I really appreciate that broader system perspective when we talk about AI in healthcare. It's easy to imagine a doctor using a chatbot during consultation. At the same time, the point about bias in data is extremely important because I've seen like maybe some of the article talking about the AI bias in data. And I think that is correct and is really happening every time we look for the answers through the chatbot. Okay, so one of the biggest concern regarding AI is the risk of inaccurate information, commonly referred to as AI hallucinations. In healthcare settings, how can professionals ensure the safe use of generative AI in order to maintain patient safety?
Thank you. So this is very important issue. I would start with something very simple. Never confuse confidence with accuracy. AI can give you a beautiful, written, very confident answer and still be wrong, right? And for medical students, when you're a student, that may mean a wrong answer in assignment or in your presentation, right? But when you become a clinician, it can mean something much more serious. So verification is not optional, right? If AI give you a clinical recommendation, please check it again against trusted guidance and evidence, and understand the arson and understand how to apply your professional judgment. And patient information deserve particular caution. Identifiable patient information should not simply be entered into public or unapproved AI platform, right? So privacy and data governance are fundamental boundaries, not only administrative inconvenience. I recommend using only institutionally authorized system and considering re-identification risk, even when data appear uh, anonymous, right? And then there is a simple mnemonic that you, as medical student, might find useful for remembering this principle. So use what we can call pause, PAUSNE. First, protect privacy. P, right? Patient privacy is supposed to be protected. So if you are entering any question to the AI chatbot, don't use the real name of the patient, their number identification or anything patient identification. And then A, assess accuracy. You get the answer, but you need to asking different resource. Need to see the guidance, the 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 right resource for assess the accuracy, and then you understand bias and uncertainty. Okay, understand. You can see the bias there. You can focus and take a look on that. And then S, seek human supervision. So if you're still student, you have your senior, you have your lecturer, you can seek human supervision. Or if you're working in the hospital or puskesmas, if you have your supervisor, you can ask for supervision if you're not sure. And then E, explain and document appropriate use. So you need to always document it either in the medical record, in uh, documentation what you have been done. So pause. Any using of the AI for the patient, pause. Stop for a moment, thinking for a moment, doing this step by step. Protect privacy, assess accuracy, understand bias and uncertainty, seek human supervision, and explain and document appropriately. I think that's very simple to remember. And then responsible AI does not always need to begin with a complicated regulation. Sometimes it begins with a health professional knowing when to pause.
Okay, that is very beautifully constructed. The pause framework you mentioned provides a very practical way for students to remember responsible AI use, protect privacy, assess accuracy, understand bias and uncertainty, seek human supervision, and explain a document appropriate use. That's very good, I gotta admit. The implementation of generative AI certainly raises serious ethical issues like the privacy things and bias things, um, ranging from patient data privacy and transparency to accountability. In your opinion, which ethical considerations should receive the most attention at this time?
Thank you. So, World Health Organization ethical lens emphasize autonomy, safety, transparency, accountability, equity, and sustainability. Instead of treating this as abstract ethical principles, I think we can turn them into practical questions to make it easier to understand and apply. So, for example, would the patient understand that AI influence in this decision? Do we have evidence that this system works safely for this population? Remember about the bias, okay? And then, can the clinician challenge the AI recommendation? Who is responsible if something goes wrong, right? And then, can the system be maintained, audited, and improve responsibly? And perhaps especially relevant for Indonesia, again, whose data missing? Is there any language missing or experience are missing from this data that we retrieve? Remember, equity is not something we can add after an AI system have already been designed. It has to be designed from the beginning.
Okay. I think what makes those principles particularly useful is that they can be translated into very practical questions, especially when you emphasize about the people in Indonesia whose data, language, and experience are missing because there are really a bias from the like development of the like how AI can answer our questions, right? They put the certain data from certain population rather than the global population. Okay, so as technology continues to advance rapidly, there is a concern that reliance on AI could diminish the human aspect of medicine. How can healthcare systems balance technological innovation with empathy, communication, and care that remains centered on human being or human centered care, if you will?
Thank you. AI could help us become more human if we design it properly. So think about how much time health workers spend on documentation, coding, reporting, searching for information, and repetitive administrative tasks. I think that's happened everywhere, if you realize. And then if AI can safely reduce some of that burden, then perhaps the doctor have 5 more minutes maybe to actually look at a patient, to each patient. It gives more time, right? Rather than doing this administrative tasks. Sorry. So, if AI can safely that time and provide this time for the doctor to listen, explain, and ask the patient, right? Like, what you worry about? Is there any concern from you? Is there anything else I can help? Like, give some more, even just 5 more minutes for doctor to each patient to listen more deeply to the from doctor to the patient. That's something important, I think. That's something that we need, right? So healthcare is not simply transfer of medical information. A patient may forget the exact laboratory number you told them, Is there any patient you will remember the laboratory number? No. But they will remember that you listen to them where they're scared, where they're frightened, right? They may remember that you explain their option, right? And they may remember whether they feel respected because you give 5 more minutes for it. So AI can process enormous amount of information, but healthcare still happen between human beings, between you and your patient. So I don't see the goal of choosing between technology and humanity. The goal is to use technology in ways that give health professional more space to be human.
Okay, that is very profound, I think. The way you like explain 5 minutes is crucial to give a reassurance to the patient so they may feel more like relaxed, respected, and help the maybe the doctors like find some crucial missing point from using AI. So we can move on to the next question. To ensure that AI is used safely and ethically on a global scale, regulations and guidelines are absolutely crucial in promoting the responsible use of generative AI. What role does the World Health Organization play in developing guidelines or policies for the implementation of AI in healthcare?
WHO role is to help countries navigate this technology in ways that protect health and public interest. That includes developing guidance on ethics and governance, supporting standard and responsible implementation, bringing together governance, researchers, healthcare professionals, and community and other stakeholders to address questions about safety, evidence, accountability, and equity. In Indonesia, WHO work in coordination with Ministry of Health's EI for Health Committee, including through technical discussion and sharing relevant World Health Organization guidance. WHO is also discussing future support for developing a policy brief on responsible EI for health to help inform future governance in the health sector. But importantly, implementation cannot simply be copied from one country to another. That's important to understand. Indonesia has its own health system architectures, population, language, geography, digital infrastructure, and regulatory environment. So global AI principle must be translated to country or locally appropriate government.
Okay, regarding that, every country has different levels of digital readiness and access to technology. And this directly integrated to the next question. How can generative AI be implemented equitably to improve the quality of healthcare services without widening existing disparities, particularly in developing countries such as Indonesia?
Okay, so for Indonesia, we need to start with geography. It is incredibly different archipelago, right? Some people have access to sophisticated hospital and universities. Others have multiple challenges in access basic health services. So when we talk about AI in Indonesia, I would ask, where are the biggest gap in our health system? And can technology help us close them? So, for example, if you heard the term of DTPK, it is meaning remote border and islands area. with puskesmas in that area face several challenges simultaneously. Imagine EA that is actually designed for that environment. Something that hopefully can function with low connectivity and electricity. Something that understand local language and context. Something that simple enough to fit with routine puskesmas workflow. So again, maybe it can help health worker identify high risk pregnancy earlier or recognize a child who needs urgent referral. And perhaps it provides guidance-based support with, let's say, hospital or specialist is hundreds of kilometers away. Maybe it helps with district to understand where medicine, diagnostic, or health worker are most urgently needed. And there are exactly the kind of health system function that we should exploring responsibly. So this maybe happen, but AI, it can be helped by AI, what I just mentioned, but AI cannot become an excuse not to invest in the fundamental of the health system. The fundamental health system first. We still need trained health workers. It cannot be replaced, right? We need medicine. We need diagnostic. We need infrastructure. We need transportation. We need connectivity. We need referral system. We need financing. So for the TPK area, hard to reach area, I would not measure AI use success by how sophisticated the algorithm is. Come back to universal health coverage that we are advocating for. Where you born or where you live should not determine whether you receive timely quality healthcare. Meaning people in the TPK area has the right to access the timely quality healthcare as well. Instead, I would ask, did people get care earlier in the right time? Did the health worker make a safer decision? Did fewer patients drop out for referral from puskesmas to hospital? Did access and quality improve? Or did we reduce the inequity? So that is when the innovation that matters. If AI only improve healthcare for people who already have the best hospital, who already have the fastest internet, and already have the greatest access to specialists, then we have not yet achieved equitable innovation.
That is very, very good, I think, because regarding to maybe thinking retrospectively about what happened, or maybe in current situation, um, in Indonesia, some of our community or even areas, they don't have the equity to access the healthcare, don't have the things for the requirement to access the healthcare, right? And yeah, and it's very complex, I think. And we've discussed everything from education, clinical practice, patient safety, ethics, regulation, and equitable access. I'd like to maybe close our discussion with what may be the most relevant question for our listeners, especially medical students and future healthcare professionals. In your opinion, what should medical students start doing now to prepare themselves for a medical world that is becoming increasingly integrated with AI?
Thank you so much. So I think again, thank you for this opportunity. This is something important. I think it is the great things that Chimsa has been doing. And then for my closing reflection, I want to say that you are very lucky entering medicine at very remarkable moment. Previous generation of health students they bring textbook, they carry textbook. Your generation carries an AI companion. And then this is extraordinary. You will have access to information and tools that previous generation of doctors could barely imagine. So use them. Be curious, learn how this technology works, but also learn when not to trust them, when not to trust the AI. Learn to question them. Learn to question the AI. Learn to recognize uncertainty. Learn about AI weakness. Never allow confidence to reply your responsibility. Because one day you will be sitting across from a patient. And maybe not AI, there is no AI there. Maybe you will be in a sophisticated hospital in Jakarta. Or maybe in a puskesmas in small island. Or maybe somewhere we cannot even imagine today. There may be AI system beside you to help you to analyze thousands of point data in second. Maybe there is not, right? But who will be there? Patient that will look at you and ask question. Doctor, what does mean? What should I do? Doctor, am I going to be okay? So there will be a human being that sit in front of you. There is you as human being that will answer them. Right? And you're the one they trust, not the AI. So yes, become excellent at using technology is important, but become even better at being health professional, meaning become a better human companion to the patient. The future of healthcare will belong to the health professional who know how to use powerful technology responsibly while never forgetting the person, the patient in front of them. And this is the message that I would leave with you. I think the highlight one, AI may help us close this distance, information gaps, and some workforce gaps. But our responsibility is to make sure it also help us to close the health equity gap. Because that is what bring innovation back to its real purpose, to provide better health care for everyone, everywhere.
Okay, that I think is very um partly dystopian because living in this current situation of our maybe country or even world, there is someone sick and seeking your help, and I think that is very profound to be contemplating about. So it is, I think, very crucial to maybe think about when we're entering this field of career. So, thank you so much for that thoughtful message. I think one of the most, maybe not one of the most important takeaways from today's discussion is that the future of healthcare is not about choosing between humans and technology, and maybe learning ethically, not avoid learning by using AI, and maybe develop and how to learn to use AI responsibly. So thank you so much, Mrs. Indraini, okay, for taking the time to join us for sharing such valuable insights and the World Health Organization's perspective with us today. It is clear that no matter how powerful AI may be as a supporting tool, the heart of medicine will always be grounded in empathy and the human touch. We hope today's conversation gives us not only a better understanding of generative AI, but also a reminder that innovation should always return to its most important purpose: health for everyone, everywhere. To everyone listening, thank you for staying with us until the end of this episode. Don't forget to subscribe, share this episode with your fellow medical students or healthcare professionals, and share your thoughts in the comments section. I'm Aryo Jalo signing off. See you in the next episode. Thank you very much.
Thank you, everyone. Thank you so much.